Good afternoon, everyone. Welcome as you're joining. You're very welcome. We've got a few people joining, so we'll just give them a minute or so for you all to get online. When you're online, one of the first things we ask you to do is to introduce yourself in the chat. So find the chat and then just pop in there your name, where you're from. We'd also like you to announce your pronouns so we know how to address you if you've asked a question in the chat, so please do that too. And just bear with us. We've got a few hundred people joining, so it does take a little while for everyone to get online. And let's see who can be first into the chat to put where they're from and who they are. We love to know. Oh, Maureen, look at you. You're so fast all the way from Tambo. So lovely to see you here today. Thanks, Victoria, for joining as well. Jude, she, her, thanks, Jude, from Ipswich too. Fantastic. What's the weather like up there? And Townsville, we've got a lot of people from Queensland. How wonderful is that? Hello to all of you. Do let us know where you're from. And also announce your pronouns would be terrific so that we know how to speak about you if you ask a question. That'd be really great. Meanwhile, we'll just give everyone just another probably 30 seconds to join and then we'll get started. So if you're just not joining now, welcome. So lovely to see you here. We really encourage you to pop your name in the chat and also to tell us whose country you're on and also what pronouns you prefer us to use. That would be really great. And in just a few seconds, we'll start our research webinar proper. So almost there. We might just wait just a couple more seconds. And hopefully you found the chat. So I can see 37 people have put their names in the chat, but there are 108 of you at the moment, which means there's 80, oh, how good's my maths? 50, 40, 60, 70 still to go. So keep sending them in. Let us know where you're from. Let us know what pronouns you use. Let us know what country you're on. Say hello to people. We really encourage you to be as interactive as you can be in the chat. All right, I'm going to wait for 4 more people to join. And then it's 3 more people to join. And that's, we're slowing down, 2 more people to join. And then I'm going to get us formally started. 1 more person to join. I feel like I'm on an auction, going once, going twice, and going 3 times. There we are. We've got 115 people now online. Oh, great. Good on you, Sabah, for saying hello to Janelle. That's exactly what we want you to do. If you know someone, say hello to them in the chat. We've got nearly 120 people online. So far, about half of you have gone into the chat, so we'd love the rest of you to now go into the chat. We'd like you to say hello, say whose country you're on, and let us know which pronouns you use, so that if you ask a question on, just so that we know who you are and how to speak about you if we need to do that. That's fantastic. So while the rest of you are doing that, we're going to get formally started with our day today. So my name is Elizabeth Devaney. I'm the CEO of Consumers Health Forum of Australia. My pronouns are she, her. I've got my green she, her on today, and my favourite badges. As usual, our webinar will be recorded. We're recording you right now and be available to use on our YouTube channel, and we will send you out the link after this. So don't worry if there's something you don't quite catch it, you want to watch it again. We've got some brilliant speakers. You may want to watch them again and again and again. You'll be able to, because we're going to send you the link. So as we start, I'd like to acknowledge that I'm in Naarm today. I'd like to acknowledge, in my case, it's the Wurundjeri people of the Eastern Kulin Nation. I'd like to pay my respects to their elders, both past and present, and also acknowledge their continuing and unceded connection to this land. We've got some other amazing people here too, who I'm sure are First Nations people I can see in the chat, so I'd like to particularly welcome you here and pay my respect to you also, and acknowledge your important role in our communities. So what are we doing today? Well, we're really so happy to see so many of you joining us today for this important topic, research and the consumer. We've heard from consumers for a long time that research is an area of great interest and something that people want to get more involved with. And we think you should be in the driver's seat because it's your health. And a lot of research money, of course, is government money, which means it's your taxes at work. So not only is it your health, you're paying for it. So it's very important for you to feel confident and comfortable to engage with research whether it's participating in a clinical trial or being part of a group that decides what funding is allocated, or even understanding what research advice means. You know, we say nothing about us without us, and that's true for research as it is anywhere else. And we think it's important that consumers would expect that organisations like CHF are involved, and where we can, help provide you and build your communities, your capacity to be a consumer health person who's involved in research. For us, what we know is that we can't always do it from CHF's perspective. We don't get any money for research. We don't get any money to build your capacity or to advocate on behalf of consumer research in Australia. So if you're winning Powerball tonight and you've got to spare 100 million, think of throwing us a few, and we'd be very happy to use it to build the national capacity for consumer research. Now, down the bottom, you might have discovered there's a research, there's a reactions tab. Hopefully, sometimes a bit hard to find if you're on your phone, but if you're on a laptop or an iPad, you can see it. You've got it, great. What I'd love you to all do now is just practice using it. So I think that there should be more money go into supporting consumers to know about research. If you agree with me, show me with an emoticon. You can have a smiley face, a heart, a clapping, whatever you like, party, all of those things. Love it. Get used to that. Now I've got another question for you. Sometimes what we hear is that consumers can't be involved in research. They won't really understand. It's all too difficult. Too technical. Show me what you think about that comment. We really can't get consumers involved. It would just be awkward. They don't understand the jargon, and it's maybe a little bit difficult for them too, because, you know, they're not trained like we are to understand these things. Oh dear, some of you are very worried. You probably heard those sayings, perhaps too. So during the day today, we've got these three terrific presenters. It's really tough for them because I can't see you. So what I encourage you to do is keep using those emoticons and the chat. So if you like what they're saying, do what you just did now. If you don't agree, let them know. At the end, I'll ask you to give them a virtual clap that way. Use the chat as well to encourage them. If they like something, feel free to put here, or exactly, I agree with you, or I don't. We've also got Q&A. Q&As if you've got a question that you want to put to the panel at the end of the session. So if you are listening and you've got a question for our panelists, write it straight into the Q&A. So the chat's more for general conversation. The Q&A is for specific questions. So we've got about 142 people now online. So I'd say we've got about a bit over 50 of you who have yet to go into the chat. So I'd love you go into the chat, put which country you're from, and let us know your pronouns, say hello to everyone so that everyone's been in there and is comfortable to be in the chat. So as I said, we want to get you thinking, get you involved. So to kick things off, we're going to start with a poll. So the first poll that we're going to have is going to ask you, how would you best describe your current level of involvement in research? So we've got some options there from none to heaps. We'll show you the results a little later on. So now what we want is 143 people to click one of those radio buttons. We have really designed this for people who are at the start of their journey, but we recognise you might have some people who've been doing this for a long time also on the call. So pop in where you are right now. Just give you a few more seconds to do that. Hopefully that's an easy question. You know exactly where you are. And then the second poll we'd like to run is, if you're engaged in research at the moment, let us know what you're doing, because there are so many things consumers can do in research. Are you participating in work and focus groups? Are you involved on the board or a committee, perhaps an ethics committee? Are you writing articles? Are you the researcher themselves? Are you a consumer advisor? You can tick as many as you like. If you're doing all of that, you can tick them all. If you're just doing a few, tick the ones that you're doing. We're really interested to know, and again, we will show you this later on, what kinds of involvement are you having in research? So I'll let you do that. We've still got just under 50 of you who haven't been into the chat yet. Really encourage you to go in there, introduce yourself, let us know what country you're on, and also your pronouns. Say hello to people. That would be really great. Okay, I think you've all probably had almost enough time to read that, because there's a little bit in that poll. Just give you another few seconds to read through and think about, have I done these things? And then click the boxes. You can click as many as you like, and we will be providing you at the end or towards the end of the session with the answers, so that you can see also who was here today. Great. Okay, so as I said, we've got a really terrific bunch of people with us today. So do introduce yourself and I also encourage you to spark a respectful discussion on topics. If you've got a question, as I said, it goes into the Q&A and we'll be asking the speakers questions along the day. As also at the end, we'll have a bit of time for Q&A. We don't always get to them all, but remember that whatever you tell us, we listen. And we might use it in advocacy or in preparing our next webinar on research, because there might be some questions there we haven't answered today. I mentioned the emojis and I'll mention them again. Do make sure you welcome the speakers, thank them, and during their session, let them know how you're going, if you're enjoying what they're saying, if you support what they've said. And we're going to try and do a few things this afternoon. Firstly, we thought it'd be good to explain what we mean by research. So let's define what are we talking about and what that looks like in the real world. And then we're going to hear from our panel members who will each give a short presentation explaining their experience in research and answering that important question of the role of consumers in research, and give you a really good sense of the different kinds of things you might actually be able to do. So let's start with definitions. So in the National Statement on Ethical Conduct of Human Research, the NHMRC, who many of you will know, but for those that don't, it's the National Health and Medical Research Council, says there's no generally agreed definition of research, but it's understood to at least include investigation undertaken to gain knowledge or to train researchers. So that's what we mean. The NHMRC reports that human research has been conducted with or about people or their data or their tissues. What we mean by tissue is human tissue, which is an organ or a part of a human body, or any substance which is extracted from a human body. Think, say, a blood test, for example. Now, in terms of real-world examples of consumers and research, we've found quite a few. People who joined our last webinar, if you didn't see that, we might drop the link in the chat on AI in healthcare, which is very popular. There have been hundreds of people view this on our website since we did it. There we showcase the work that Professor Stacey Carter's group had been doing in the University of Wollongong. They ran a citizen's journey on AI in healthcare that involved 30 diverse Australians who learned about AI in healthcare and then developed recommendations for policymakers, which are now being used by the New South Wales government. There's the Australian Clinical Trials Alliance, who some of you might be familiar with, and also the Advanced Health Research and Translation Centres. Again, some of you may be familiar with these. These have working groups where consumers can be involved to help guide what best practice might look like in consumer engagement in medical research and clinical trials. And the Royal Eye and Ear Hospital in Victoria partners with consumers to be involved in research design, planning and training on ways to improve what the hospital does when it delivers eye and ear services. And finally, just a note about CHF. We convened Australia's Health Panel in 2018, so it's 6 years old. And this panel is dedicated to collecting the views of Australians on a variety of healthcare topics. So this is our survey instrument. We run a survey every month or so on topics that are of interest. We recently ran one on AI. So if you're not on our panel and you'd like to be, we will put the link in the chat. You can see it just there. You can join that. What that means is every time we run a survey, we send you a note and say, we're doing a survey, you're interested. Obviously, you don't have to be involved, but if it's something you're keen on, you can say yes and do the survey online. So we use these responses as another way of us contacting consumers, because we know some people want to do focus groups, others want to be on roundtables, some want to come to webinars, and some want to be involved in surveys. So as best we can, we try to do different ways of getting information from consumers. So we did do AI just recently, and we really encourage everyone here to join and be a part of our survey community. And thanks, Shannon's just put in the chat the work we did, because this the panel that we used that information from that survey to inform our submission to the Senate. So to Parliament House, your ideas from that AI survey, if you're involved, they went to Parliament House to say this is what Australians want. So from CHF's perspective, it's never really what I want or even my board wants, dare I say. It's always what the community wants, and how do we make sure that politicians and other people making decisions know what community wants. Okay, I think that's enough from me. And let's get started on the presentations now. First of all, I want to introduce Melissa Lemessurier, who uses the pronoun she, her. She's joining us today as our consumer representative, and I'm sure many of you will know Melissa. Melissa is a consumer representative and chair of the Consumer Advisory Committee for the Victorian Comprehensive Cancer Centre Alliance, or some of you might know it as the VCCC. Melissa has been a consumer advocate for over 2 decades, and she's really passionate about promoting consumer leadership in health and medical research. In addition to her role on the VCCC Alliance, she's also a member of ANZUP's Consumer Advisory Panel and a board member of Lung Foundation Australia, and a whole lot more besides. Melissa, it's really great to have you joining us today, because you bring so much experience, both as an advocate and also as someone who's been really involved in consumer research in health for a long time. So I'm interested for you to do a bit of a memory lane piece for us. How do you think you've seen that and consumer involvement in research change since when you started?
Thanks a lot, Elizabeth, and welcome everybody. I saw quite a few familiar names come up there in the chat, so it should be a really great afternoon. I was a consumer advocate or patient representative before I even knew what it was, and it goes right back to 25 years ago, and I'll talk a little bit about my journey in a minute, but I just might put up a first slide, which, as Elizabeth said, I've got a few different hats, but the VCCC Alliance, who I'm currently volunteering with as chair as their Cancer Consumer Advisory Committee. Many of you will be familiar with the IAP2 model, and it goes from left to right there, if you like, the increasing involvement that consumer or community representatives can have. And it can go from quite a passive involvement when you're starting your journey and you want to find out for more information, right through to consulting, involving, telling your story, then true partnership with clinicians and researchers, and then at the furthest stage, become a leader of consumer-led research. And we'll hear a little bit more about that from the other speakers today. But while that model's fantastic and internationally recognised, I just thought I'd also show you what I interpret that is in my own personal journey, which is pretty similar, but I've flipped it a little bit, because the IAP2 model talks to how others can engage consumers. I've tweaked it a little bit to think about my journey and others that I know, where you really quite often become involved in research due to being diagnosed with a condition, or a loved one is diagnosed with something. And in my case, that does go back 25 years, and my son was diagnosed with cystic fibrosis at birth, a few weeks after he was born. And as any parent would, I got heavily invested in, was there a cure for this damn thing? And joined with other parents and clinicians and set up a research trust at the Royal Children's Hospital in Melbourne, where he was born and treated for the first half of his life. And has a good ending to that story, which I'll come to at the end of my presentation. But I guess raising funds and awareness, and I think we paid for the salaries of about 20 clinicians over those years. I wasn't really, I guess, formally felt I was a consumer advocate or representative to 5 or 6 years ago, 7 years ago, if my maths is right, when I was diagnosed with bladder cancer. And that made me, again, perk up. It's a type of cancer that doesn't often have good outcomes, and it's a bit unsexy. It doesn't get much of the research dollar. So I had a very vested interest there to learn what was the latest. So moving again from left to right, becoming a supporter of a cause for yourself or a loved one, to becoming a participant and, sitting in meetings, going to focus groups, giving your opinions through surveys. And then I guess stepping up again in being an active contributor. And that's where, if you're happy to tell your story to others, either to clinicians treating you, or the hospital service, or the fundraising advocacy group, and then also getting deeply into the research right at the start. So many of us don't understand there's a really long lead time before any research gets funded. And I joined ANZUP, which is a cancer clinical trials group that looks at cancers below the belt, is the easy way to explain it: bladder, kidney, penile, prostate, and those cancers that many of them are very lowly funded. So there's a few people on the call, I think, that are members from ANZUP, and I'm a member of their consumer advisory panel, the CAP, led by Belinda Jago and Leonie, who'll speak later. I've learnt heaps from those two and other participants. Then a couple of years on, as I got to know the community and understand what research was happening, I actually became a formal partner. I actually became what's called either a CI or an AI, which is an investigator. So when grant applications go into the government and to other funding bodies, your experience and your involvement is actually listed along with the doctors, the scientists, the researchers, whoever else might be there. And that, I guess, is a quite, at the first you think, oh, what's my name there? What papers have I had published internationally? Zero in this area. I've got expertise in the corporate world, but it's, I guess, when you start to feel formally involved in research, again, not for everybody, but even before you're on a research actual project, you can review information. We spend a lot of time translating scientific information into lay terms. And my view is that that's a good thing both for the consumer but also the researchers, because if they can't explain what the hell they're doing in plain English, it's not a good thing for them either. And I guess I reached the pointy end of consumer advocacy in July last year when I was appointed chair of the VCCC Alliance Cancer Consumer Advisory Committee. And that reports to the board. It's a formal role, and we set the research agenda. I was heavily involved in the upcoming strategy and program of work, and they truly model best practice consumer leadership. And again, I have learnt so much from the other consumers that I often speak on behalf of. I chair the meetings, they actually add the gold, and at no time do I feel my knowledge is more or less worthy than anybody else's. And it doesn't matter whether they've got 17 PhDs and they're a professor, or they're a person who's simply suffering from a disease and wants to help advance the cause. And most of it is altruistic. We don't expect to benefit ourselves. And I've been on a clinical trial for bladder cancer. That wasn't for my benefit, but for the people that will come behind. So that's probably enough for me. I'll be talking at various points with the other presenters, and look forward to getting your comments and your chats. And thank you for those few love hearts. I can't see your faces, but I hope that's a typical journey. Happy to be corrected, if not, by anybody who's taken a different path.
Thanks, Melissa. You are getting a lot of love there in the chat. Encourage people, if you like to support things that Melissa said. I also see we are getting some questions in the chat and some questions in the Q&A. And I can see we've got some people who are here today who have been involved in research for a very long time. We'd encourage you, if someone's got a question and you've got an answer, feel free to put your answer in the chat too. Perhaps they're asking about a resource, or they want to know if something exists and you already know. Feel free to put your link or your comment to them as well, because we're all very keen to share our knowledge together. So thanks, Melissa. We're going to move on now for our first presentation. And I better get this one right, because one of my board directors is the next person to present. So I'd like to introduce Associate Professor Daryl O'Donnell, who uses the pronouns he, him. Daryl's an experienced health leader with a 30-year track record in community, research and public sector roles. He recently established a consulting company, allowing him to work with a wider range of organisations to improve consumers' experience of healthcare. His tenure as CEO of Health Equity Matters saw him lead Australia's HIV response, brokering reforms that have halved the incidence and put Australia on track to end HIV transmission. At the Mental Health Commission of New South Wales, he established a new public sector agency driving major mental health reforms, and his academic contributions and research in partnerships in public administration and health policy have earned him an adjunct professorship at the University of New South Wales. He's a passionate consumer advocate, serving on the board of CHF, as I mentioned, and promoting reforms to research, governance and administration through the National Health and Medical Research Council. Daryl is also currently chairing the review of the CHF and NHMRC National Statement on Consumer and Community Involvement in Health and Medical Research. So let's give Daryl a really warm welcome, and over to you for your presentation. Thanks, Daryl.
Thanks so much, Elizabeth, and it's so wonderful to be here. So I'm thrilled to see so many people joining, and I know this is an area where there's a lot of passion and a lot of enthusiasm to actually getting better results, and so it's really great to be having a discussion as consumers about our experience of research. Melissa has actually touched on something really important for me as well, which is that burning need and desire to understand, to make sense of what's happening in our lives when we or one of our loved ones is hit by a serious health condition, as she described for her son and also for herself. And that's also part of my journey. I'll touch a little bit on that. Can I begin by acknowledging that I'm joining from Ngunnawal country and pay my respects to elders past and present, and just to acknowledge and celebrate Aboriginal and Torres Strait Islander people who are joining us today. So there's two things that I'd really like to do today. I want to share a little bit of a biography of my own journey as an advocate and how I came to be engaged in research. And from that, to offer some reflections and practical suggestions from what I've learned, and hope that they might be useful for people who are starting off on their own journey. So let's start with a couple of questions. Why would someone who's not a researcher care about research? And why should we, as consumers, as advocates, why should we care about research, about good research, about community-centred research? Those are two guiding questions for me. For me, the answer to those questions is really part of my origin story. I came out as a gay man in 1990 to a community that was in crisis. That was a time when the HIV epidemic in Australia was at its peak, and when gay men, often young gay men, were being diagnosed with HIV and AIDS in devastating numbers. A diagnosis in those years often came when people were presenting in doctors' surgeries and hospitals with awful infections as their immune systems weakened, and thousands of people were dying. And it was a very common experience for people in my generation and those who are older than me to be driven by the horror of what was happening around them to community action, to community organising. And we were frightened and angry, and so coming together, mobilising to educate others, to provide care, to advocate, provided us with a way of doing something to ease the awfulness of what was happening. Just on this slide, there's a couple of photos I just want to highlight. That top left slide is very, very early in the global AIDS response. It's around 1983, 1984. And the message, we need research, not hysteria. And implicit within that, we need the rationality. We need the evidence that comes from research, not moralising and panic. So for gay men, research was and remains the pathway through the HIV epidemic. At the time of that photo, we needed a test for HIV. We needed drugs to treat HIV. And today, 40 plus years later, we need a cure. Down the bottom left, we've got a photo actually from Melbourne. You can see, if you look carefully, you might be able to see some of the marchers have candles in their hands. That photo is taken at a candlelight vigil for those who died in Melbourne in the early 90s. And the message, though, is clear that even in the midst of grief, there's a determination, fighting for our lives, there's a determination for action. And then on the right-hand side of this slide, if you're eagle-eyed, you might spot me in two places. I'll show you the close-up on the next slide. There we are, there's the close-up. On the left, on the right-hand side, sorry, I'm carrying a sign that says loud, and yes, that is decorative fringing and tassel work on that sign, you can see. So for me and thousands of others, our lives had been caught up in something catastrophic at that time, and we're acting on that. We're seeking to make a difference, to actually make a contribution to efforts to get through what was happening in our lives. And a huge part of that was actually searching out and creating information that could help our communities in that process of making sense. If we can go to the next slide, this is Sue Kippax, one of my heroes, one of the heroes of Australia's HIV response. And she's recalling in this quote that you can see on the slide that activists at the AIDS Council of New South Wales had gotten in touch with her and other social researchers at Macquarie University in Sydney in the mid-1980s to ask for help in gathering data to understand how gay men were responding to community messages about safe sex. And so together, the researchers and gay community members designed a study, and that was called the Social Aspects of the Prevention of AIDS Project, which was eventually funded by the New South Wales Health Department. It was the first of its kind, and it became a model for how community and researchers would work together in Australia's HIV response. And so through that research, the community gained a better understanding of HIV, one that they couldn't have obtained without the support of those researchers. And for the researchers, they were able to recruit participants into their study, gain a better understanding of gay men. And they couldn't have done that without the support of community. And so it's demonstrated in the quote on that slide, that early working relationship between communities and researchers in HIV started with the needs and questions of community. It started with community. And we desperately needed information and knowledge, and we needed the expertise of researchers to help us create that. So that project that I was describing, the SAPA project, involved community members right throughout the research process, from design to dissemination of findings. And the steering committee for the project met about every 6 weeks to develop the questionnaire, the recruitment strategy, the selection of interviewers, as well as to discuss the results and develop a plan for disseminating results back to the gay community. Now, not every HIV research project occurs in that way, but what it did was it established a model, a sort of a footprint, a blueprint for how research should be conducted in Australia on HIV. And at the heart of that model is trust and respect. You can see that Sue's reflecting on that in this slide. A recognition is built into that we need good research to get through the HIV epidemic. That means we need researchers to be interested in HIV, to see this as an area where there are positive and productive partnerships, and to know that they'll actually be valued for their contributions. The model of early engagement that I've described today is described as a partnership between HIV community organisations and researchers. It's taken a long time to grow from those early beginnings to a more mature set of relationships between researchers and community. So when we talk about partnership in our response to HIV, we mean something very particular. We don't take partnership ever for granted. We see partnership as always an active and continuous process. It's something we create every day through our interactions across the partnership. When community members are interacting with researchers, when researchers are working with clinicians, we're actively creating a set of relationships through trust and respect and mutual recognition of what each other brings. So that trust, that active process, the respect of the expertise that communities bring, that researchers bring, and through partnership, actually experiencing the testing of the strength of that partnership when there are differences, when there are divergences of views, but fundamentally being focused resolutely on the concerns and goals of communities. That's what partnership is. And so Graham Brown, in his quote, highlights partnerships are not easy and they're not necessarily natural. They actually take work. It's not just about being unconditionally positive. This is hard work. So here's Graham again, this time observing the power of communities, of advocates in demanding solutions built from research evidence. So 35 years later, what have I learned? What are my reflections on working as a community activist with researchers? Well, first of all, not all research is good research, but when research is responsive to the issues that matter to us, when it's genuinely collaborative, when it stems from the same determination as ourselves to improve health, then we have good research, the research that we want as communities and that we need. The response to HIV research has given us the drugs to keep people alive and healthy, and the tools we hope that will allow us to end HIV transmission in Australia. And all of that's happened in just 45 years. For me, it's fundamentally important to have a two-way respect, to have researchers recognise the power and the value of lived experience. When we have lived experience, we have known intimately the issues that researchers are seeking to understand. It's not an objective problem to us of other people. It's right here in the centre of our lives. But equally, researchers bring technical knowledge and expertise built from years of academic learning. It's valuable, and we must value it. So for me, a final few learnings: researchers can be an intimidating bunch. In my experience, though, there's no faster way to a researcher's heart than genuine curiosity. For example, I saw your journal article and I wanted to let you know how interesting I found it. It resonated with my own experience. I'm really interested in whether there are any surprises in the study for you. Or, thanks so much for your work in this field. The research is really helping to change my everyday experiences. I'm wondering what you see as the biggest questions that still need to be answered. So this doesn't mean being unconditionally positive. Our job as consumer advocates is to always stay true to our own experience. And if the research isn't good research, we must call it out and do so by highlighting what's needed to make it good research. Just a final learning for me, our advocacy is always more impactful when it's informed by an appreciation of the diversity of lived experience, our own and that of others. And it's much more fun when we're reaching out to others through our networks, through community organisations for support and to learn and to mobilise. Thanks so much.
Thanks, Daryl. I'm going to act as a little bit of a reporter between each presentation. So I saw a lot of common interests and inflection points there between our presentation. But number one, I think passion and needs drives consumers in research. But can you talk to me a little bit and talk to the audience about what you talked about, the partnership piece, but relationship challenges you might have faced, any pushback from researchers? You were obviously also in a different society context during the AIDS crisis. So are you able to talk to the people on this webinar about what you learnt during those years and how to stay positive and what can be sometimes challenging experiences?
Yeah, thank you. Good question. Look, it can be challenging. Sometimes we see research that that doesn't reflect our experience, that doesn't involve us in the ways that it should, where there are problems, where it is not the research that we would wish to see conducted in the ways that we have come to expect. My experience is always you get much further by working with and to create change and doing that in a really positive, but actually a really determined way. So holding together that I want to be in relationship with you, but that doesn't mean that I'm going to agree with everything you say. And so for me, there have been really challenging moments. Over the years, there have been times when researchers, for example, in response to HIV, have published findings that have been hugely stigmatising for communities, that have been published without appropriate kind of safeguards or processes to actually test the analysis, to test this is what we think we're seeing. Can we actually be having a conversation about whether that's right? Those are really challenging moments. That's when partnership is really tested. But I think the trick is to be determined, to be persistent, and to stay at it. And I know particularly for myself and for others, when we're starting out, you know, it's hugely intimidating, the power imbalance between us that we feel between us as consumers and between researchers can really be a massive hurdle. And sometimes for us as consumers and advocates, that can create a sort of we can sort of bunker down into an oppositional stance. And I don't think that's ever really useful. I don't think it's useful to trash researchers for their work. To, you know, that's not actually a constructive way of actually engaging in a dialogue with researchers. And it's also not helpful in terms of we need those researchers. Those researchers are asking questions that we need answered. And if they're not the right questions, then we contribute to shaping them. And if they're not asked in the right way, we contribute to the approach. But you can't get anywhere if you're not working with. You've got to stay in relationship with researchers always.
Terrific. Thanks so much, Daryl. I see there's lots of questions in the chat, so we'll come back to you and everyone at the end of the session, but I'll throw now to Elizabeth, who's going to introduce Leonie.
Thanks so much, Melissa. We've got about 11 questions in the Q&A now, and particularly I wanted to mention Chris, thanks for your question. Chris has asked if anyone's aware of any research evidence that shows the benefits of consumer involvement in research on the health outcomes that come. I thought I'd just throw that out to all of you. If anyone knows of any great research that shows the benefits of consumer involvement in research on the actual health outcomes, pop your link or your thoughts in the chat, and we're going to keep going. And while you're thinking about that, just want to share the poll results with you. So we'll look at the first poll, which was asking you, where were you in your research journey? So we can see there that we've got, you know, just under a third of people who have significant involvement. So that's fantastic. And we encourage you to also provide answers in the chat to questions people have got. And we've got some people who haven't done anything before. So for those 6 people who've identified that way, welcome. There's a big community here who really wants to support you to become a leader in health research over time. And then the second poll question we asked is, well, what kinds of things have you done? Again, we'll just share that with you so you can get a bit of a sense of the things people have done. You can see there that most people have been participants in some way in focus group surveys and the like, but quite a few people involved in governance and also as advisors. So you can see it's a real mix of different things that people have done. And for those of you that are new or have minimal participation, see all the different things that you can do as a consumer that's involved in research. It's just not one thing. So we're going to move on now, and I am going to introduce Leonie next, who uses the pronoun she, her. So Leonie Young has been a member of the ANZAP CAP since 2017 and a supporter and mentor to the CAP since 2012. Leonie was diagnosed with breast cancer in 1987, and through her family has personal experience and understanding of other cancers, including prostate cancer. Since her diagnosis, Leonie has been involved with many aspects of cancer, consumer advocacy, support, training, mentoring, and contributes to numerous research initiatives, both as an experienced consumer representative with researchers both nationally and also internationally. Leonie regularly presents at conferences concerning topics relating to lived experience. Leonie is the peer support coordinator for the Wesley Hospital's Choices Cancer Support Centre, Choices, great acronym, in Brisbane, and is an inaugural member and immediate past chair of the Breast Cancer Trials Consumer Advisory Panel. She is the recipient of an honorary degree of Doctor of the University of Griffith University, Brisbane, and the Reach to Recovery International Therese Laser Award, both in recognition of distinguished service to the community, with particular emphasis on her advocacy for people diagnosed with cancer. So please join me, use your emoticons, and welcome Leonie. And I'm going to pass the baton to you. Thank you.
Thank you so much. I'm coming to you from Turrbal and Yoruba country. I'm not too sure if I can add too much to those wonderful presentations by Daryl and Melissa. just so inspiring. But, you know, you've heard a little bit already about me. My story began in 1987, and I was just very young. I'd like to say I was a baby, but I was a young woman in my early 30s, and I had breast cancer. I had two little daughters who were only 4 and 2 years old. I knew nothing about breast cancer. I had surgery, a mastectomy, a full axillary lymph node clearance, and then I had 6 months of chemotherapy. My breast cancer was estrogen receptor negative. And from what we know now about breast cancer, I think it's highly likely that it was a triple negative breast cancer, except there weren't any labels back then. In fact, there really wasn't very much of anything back then. And so, you know, being diagnosed at the time I was meant that I was involved in consumer advocacy at a really, really interesting time, because some of the organisations that we know so well today, like the BCNA and Cancer Australia and all of those organisations, they just hadn't started, or they were just developing. And so I would just really had the opportunity to be part of these changes and to be part of the conversation way back then. And I think that, you know, I feel very fortunate about that, in a really odd sort of way that it happened to me at that young age, to be engaged at this time when I had a say about all of those things. But, you know, people's experiences with cancer, especially, are very, very different now. There's still a lot of work to do. But, you know, the key reason that this happens, and it has improved, is what the other speakers have said, it's about advances in research, and it's about collaborations, it's about people working together, and I guess working to find those better outcomes for everybody. So, you know, I didn't really set out to be a breast cancer advocate. This just happened to me without realizing. I think Melissa said the same thing. I really didn't even know what an advocate was. I hadn't even thought about it. It was never on my radar to be that. But why? I just started asking questions because things were starting to happen to me that were starting to affect me as a younger woman who'd had breast cancer and had all these treatments. And I was really not finding the answers. What was going to happen to me as a younger woman, being menopausal so early? What was going to happen to me in my old age? Well, thankfully, I've got to my old age and I'm starting to find those things out. But, you know, back then I didn't know any of those things. So I was just asking questions. I became a volunteer with Cancer Council Queensland because at that time, they were the only organisation really who were providing much support and information. And this is where I really started to become involved, and where some of my initial opportunities came from. And I still volunteer with Cancer Council Queensland today. But it did lead me to where I am today, being engaged in research and providing that lived experience perspective to enhance outcomes for people affected by cancer. But, you know, over these times, I've really started to be engaged in not only cancer, but some other areas too. And that's, you know, the opportunities that arise by being open and by being collaborative and being part of a team. That's where they come from. So in 1998, I did get invited to be a member of the inaugural Consumer Advisory Panel for Breast Cancer Trials. And this continued for me for 20 years. And for 10 of those years, I was the chair. And this really is a time that most influenced my interest in research and gave me just such a wonderful grounding in consumer advocacy and research. I learned the importance of training and education, and how to be part of a team, and how to collaborate, and how to manage when I felt out of my depth, which is really, really important. You know, Melissa and Daryl have given very, very similar examples and had very similar pathways to me. I've been able to continue these connections through research organisations like ANZUP, like the National Breast Cancer Foundation. Up here in Queensland, I'm engaged with many researchers in the universities like Griffith Uni and QUT and UQ. There's just opportunities come from all sorts of different angles at different ways that I can provide that. And I really do feel quite fortunate really, because I'm in that unique position that through my work and my other networks, I'm able to stay up to date and relevant because my experience was so long ago. And as has been mentioned, I work as a peer support coordinator at Choices, which provides support for people diagnosed with cancer. And I'm now president of Reach to Recovery International, which is that global connection for people affected by breast cancer. And this includes connections with health professionals and researchers too. So these roles have fitted so well with my research advocacy because they help me to highlight those areas that are important to research. So as we can see here, I was asked to share some valuable lessons I learned over the past 30 years. And I can tell you this, I've had lots of lessons to learn, but here's 4. So next slide, please. Advocacy comes in different forms, and consumer engagement environment has changed enormously since I started, and there's a variety of ways that we can be engaged, and there's many organizations working now to improve outcomes for people in the health system. And while this is a wonderful advancement, it makes the space quite complex and complicated. So that's one of the things I'd like to highlight. The other one is you don't have to have an amazing education to make a difference in this world, but there are some key points that will help you achieve your goals, and as well as, avoid being that tick box. So one size does not fit all. If we could go back to that next slide, one size does not fit all. It's about finding a niche, understanding your capabilities and strengths and weaknesses. And just because someone has had a certain health experience doesn't make them an expert in every aspect of work in that area. And we've heard people already talk about different ways that you can be engaged. Like any job, we start as novices and we grow and we learn through the experience and education. So people who are newly diagnosed, for example, can provide invaluable feedback around so many aspects of the treatment trajectory that perhaps those of us who are further down the track cannot. But what I'm saying is everyone has a role to play, and when people are asked for their perspective commensurate with their knowledge and their experience, then the results are way more valuable and just way more rewarding for everybody involved. Next slide. I think anyway that one of the challenges is that everybody undertaking these roles is referred to as a consumer. So only using the term consumer can add to the confusion to finding the best person for the task. So think about how that might work. You can think of all the different labels that we're given. Researchers need to connect with people with the lived experience because it contributes to the success of their grant applications. But most importantly, it ensures that their work is patient-focused. But consumers sometimes find themselves out of their depth because they've been asked to undertake a task and they don't have the skills and experience to be able to do effectively. And I know this has been raised in other forums, but it still isn't resolved. And I still think it gets lost in translation. I think there's a lot of work we can do around that to help clarify what these different roles are under that term of consumer. Next slide. But one of the best lessons I learned is patience, and that it doesn't happen overnight and things can take time. And having a seat at the table is a great place to be. Someone once gave me some wonderful advice also to say, if it doesn't work by going in the front door, find another way. You might have to go around the back door. It's about being patient, waiting for something to come up. And there's some wonderful examples that, of things that have come up many years later for me that I just thought would never happen. And this forum today is a great example of people working together and finding ways to make it happen. Next slide. So my voice, next slide, please. My voice matters and my story is valid. So there's an article, great article I found that is called From Passengers to Co-Pilots. This is the next slide there, because it's just showing what this is about, from passengers to co-pilots. It's a great description, I think, that describes the changes that have evolved over time. I can remember many years ago when I was sitting on committees as a consumer rep, the agenda and the feedback from the consumers and the report and feedback from the consumers was at the bottom of the agenda. And most often the meeting would run over time. We'd never get to that report. We'd never get the feedback from the consumer members. And people thought it was interesting, and it's not that they were dismissing it, but, you know, it's not the most important. But now, however, it's very, very different. And consumer reports and feedback is usually a standing item. It's usually at the top of the agenda. Now, this might seem really a little bit insignificant, but it really isn't, because what it is doing is demonstrating positive change and positive changes to people's attitudes. Again, our voices are being heard in today's another great example of this happening. Next slide. So we've already had a little bit of this being raised, that I think, you know, in discussing this point, it's really valid for someone to ask, well, you know, how can someone with little or no scientific or research experience possibly fit into the environment, into this environment, and be a contributor and be a effective team member in that space? Next slide. But there really are so many ways that this can happen. The consistent message is that people with lived experience can bring their perspective of their diagnosis and experience, something that's very unique to them. They also bring a wealth of diversity and knowledge and capabilities to build on this. And above all, they bring a motivation for improving outcomes and the ability to ground research in that lived reality. Next slide. So we should legitimately be part of the team and take our seat at the table. Training and mentoring are two vital components to ensure this is done well and to support consumer partners in this space. And in conclusion, we are experts by experience, and our voices are very, very important. Thank you.
Thanks very much, Leonie. That was fantastic. Great commonality between your experience, Daryl, and mine, and there's lots of fantastic questions, but I really like the symbolism that you mentioned about the consumer input going from the bottom of the agenda to the top, and I've also seen that sort of change in my time as well. I think another reflection I have of what you spoke about is the need for more consumers to speak from more diverse aspects of their experience, whether it's their personal experience or behalf of a wider community, is so important, because I think people are scared maybe at the start that they can't, you know, contribute valuably, but at the end it becomes the opposite problem. When you are well known like you are, you get tapped on the shoulder for many, many things, and it's you know, the further we can share the load and bring diverse perspectives into research, whether they're actually participating as a patient or actually representing consumers as a patient advocate or consumer representative, it's all the better. So thanks so much, Leonie. I've certainly learned a lot from you over the years, and I know you've inspired probably another generation of people who will be following in our footsteps when we hopefully retire one day. So thank you for that. I'm now going to hand back to Elizabeth, who will take us through the Q&A process for the rest of the webinar. Thanks, Elizabeth.
Fantastic, and a big thank you to Melissa too for providing her thoughts in between the sessions. Again, feel free to send us some love in the reactions. There are lots and lots of questions coming through in the chat. Keep adding them in. We might not get through them all today, but they're really useful for us to understand the next things to do in our work around research. So I'm going to ask a question now to our three folks, to Melissa and Daryl and Leonie. And I'm going to ask you, first of all, have you got any examples of where you've seen consumers being involved in the research actually changing the direction that the research took, or the focus? So how did the consumer input really make a difference? I'm going to start with you, Daryl, then I'll ask you, Leonie, then I'll come to you, Melissa. So Daryl, Do you have any examples of where you saw that consumer involvement change the way the research happened?
That's a really, really interesting question. I've seen endless examples of where together consumers and researchers are creating an understanding of the set of issues that they're seeking to explore. And that's right from the, setting the research question and conceptualizing the project through to, data analysis and results. And particularly, I see consumers really ably contributing to what does this mean? What sense do we make of this, and what does it mean for practice? What does it mean for policy? It's one of the areas that, in my experience, researchers tend to struggle a bit with. They've got the analysis, they've got the data, but not necessarily knowing how that might translate as in terms of its effect on service delivery or on policy. There's an amazing example. It's not a specific moment, but there's an amazing example from the HIV response of this, where very early, around the time that I was coming out, around the early 1990s, there was an enormous amount of research, particularly in the United States, that was coming out, but also in Australia, seeing that changes in sexual practice, changes in risk practice were actually changing. That what we'd seen in the mid-80s was people really responding to the horror of what was unfolding. And by about 1990, what the data seemed to be showing was that there was an uptick in risk practices. It looked as though people were taking more risks, being less safe. And so the dilemma or the danger for community is that gets written up in ways that are very stigmatizing, very alarmist, very damaging for communities and for people participating in those studies. What actually was happening was quite different, and a whole bunch of very courageous community advocates wrote a little book called Telling Our Own Stories, or something like that. I've gone out of my mind at the moment, but it was a little book that brought together the stories of people who were living through the epidemic and how they were actually making sense of risk, and how they were making sense of sex in the context of something that was now 8 years old, right? For 8 years, people have been asked to not have sex, or to have only ever have sex with condoms, etc. And what was starting to happen around that time was that when people were in long-term partnerships, long-term relationships, they were getting tested. And once they both knew that they were HIV negative, or once they both knew that they were HIV positive, they'd make a decision about whether or not to continue with condoms. That was what was happening in the data, but the researchers didn't know that. And so these very courageous consumer advocates actually, at a time when it was forbidden, absolutely forbidden to say anything other than it's safe sex all the way, consumers started to say, well, actually, we're finding new ways of actually navigating our way through this epidemic, and they make sense for us. And that was called negotiated safety, that we're in a relationship, we're going to test, and then we're going to make a decision about condom use. So in Australia, with those consumer advocates shaping the interpretation of that data, we had the emergence of something called negotiated safety, a phenomenon that was written up and in Australia. In the US, it took at least another decade for the same kind of sense to be made of the data. And so there was a huge stigma, a huge sort of a very punishing kind of effect for communities, where this data was appearing to show people behaving in ways that were absolutely inconsistent with what was actually going on. So it was an amazing experience of consumers shaping research findings and interpretation.
Great, thanks. A really great example. Leonie, have you seen this happen?
Well, what comes to my mind is really some of the, not so much the descriptions that Daryl gave that come to my mind quickly, but when I've been on review panels, for instance, we've been able to shape how that particular grant might have been reviewed. And we have that opportunity in ANZUP and Breast Cancer Trials too, and some of the other places I've had experience. And so where the scientists thought a question wasn't quite as important as some others, there have been occasions where the consumer members have said, no, actually, that's not right. We think this is a really important question, and we feel that it should have a higher priority. And so our voices have really made a difference in having people relook at that grant application. And there've been occasion, well, two that's coming to my mind, where they've been granted the funding on the voices of the consumer members. And I think one of the places that we can really make sure that those things happen is to be in, the sooner we are engaged in the whole process, the better. And if we can be engaged from concept development, then that's where those we can really have a say as everything is developing, because you'll find everyone sitting around the table, everyone's having their say, and as the protocol gets developed, then those concepts are there straight away. That's the ideal situation. I know it doesn't always happen that way, and you know, thankfully we're seeing that in some of the organisations that I'm involved with. But I think partly too that it's a learning process for the researchers as well, and they've not been used to engaging so much with us. It's a whole learning process for everybody. And I guess going back to my presentation a little bit, it's finding the right person who'll be able to work with them on it. And I think once we start to clarify that, then I think those sorts of changes in direction will be a whole lot more clear and a lot more easier to manage.
Great, thanks. And Melissa, what about you? Have you seen consumer involvement really changing the trajectory of research?
Absolutely. And it goes from changes in language, as Daryl touched on. One example in prostate cancer, researchers talk about castration resistance therapy. Funnily enough, men don't like that language, funnily enough. And that's been a challenge to get that out as a scientific term that it doesn't apply to, or it's not well received by consumers. Another example, again, is consumers leading researchers to look at the psychosocial effects, if it's cancer treatment or other things, financial toxicity. They might suggest you do 20 trips back to the hospital for blood tests or scans or whatever. Now, someone who's maybe already sick, already under financial pressure from having to give up or cut back work, and we're able to say, hang on a sec, no one will enroll in that, or very unlikely. So how about you change the parameters of the research? And probably thirdly, the great example I can give at the moment is my predecessor at the VCCC Alliance worked up with other consumers to receive a $1.6 million grant from the Victorian government to do consumer-led research on the evidence of consumers being involved in research. So I think someone asked the question of that in the chat. So I think all those perspectives are absolutely vital. And if the last thing I can mention is when at ANZUP, the scientific committee and the consumer committee weigh up the benefits of we might evaluate 20 research proposals. We score them. There's about 20 people involved. Our scores are usually within 1 or 2 of each other. So once you understand where the research is going, good research is valued by both.
Great, thanks. They're really great responses, folks. So I've got a couple of other questions. I'm going to throw the next one to you, Leonie, so just giving you a heads up, which is, you know, at the start of the presentation, I made a comment about consumers. What would they know about research? I mean, really. So I want to ask you a question. We do sometimes see this barrier where consumers are told, well, it's too technical, too scientific, and you've been involved in a lot of very technical, very scientific research, Leonie. So do you have any advice for consumers, and even for researchers too, for that matter, when this issue comes up, maybe how people will respond to comments like that, or how they claim a space for their expertise?
Yes, that happens all the time. I'm involved with some right now, and you know, I do not have a mathematical or statistical mind, and sometimes, or very often, I find myself in those situations. I think a little bit going back to my talk as well, it takes time and a lot of education. And I think that's one of the things that we have to be just a bit kind to ourselves as those consumer partners in that area. And I think you said right at the beginning, Elizabeth, we need more support for people, consumers engaged in these areas, to be able to enable us to get the education we need, to attend conferences. Attending conferences is one of the most fabulous places to learn and get a sense of what that technology is. And when you keep hearing it, you start to understand it. You can start to provide some feedback. But I just really am very honest about it. I have to say, if someone asks me a question about something I do not know in that technical area, I just very honestly say, that's something I can't comment on. I don't try to pretend I know about it, but it gives me a chance to go and find out about it. When there's a break in the meeting, or a lunch break or something, I might seek somebody out and ask them, or go talk to that person who asked me that question and say, how can I find out more about this so I can do work on it better with you, and just have that collaboration around learning. I think that's a fabulous way to be able to do that. And I think Melissa said earlier, when we're working with people, sometimes just providing that lay perspective around those areas is so important. So, for instance, in a grant application, if it's that very technical area, they've got to try and explain that to the community. So that's where I can come in handy and try and, or someone like me, to help explain those that lay terminology and work with. So it's really about communicating with the person, communicating with the researcher, and communicating with the team, and making sure that, I think, trying to develop up that atmosphere of collaboration where you can just send an email to one of the team members and say, look, can you help me with this? I didn't get what you're talking about. I'd like to be able to do more about it. And it's about, and I think you get that. I think Daryl said it in his presentation. It's not about being confrontational. It's about being part of the team. And I think that's really key to what we do. And sometimes it's really frustrating, and you have to sit back and go, I really want to say more. But at this point in time, I think picking your battles is another, really big lesson I learned about picking your battles. And sometimes you've got to think, what's more important? Is it my relationship here? Is it still being part of the team and having my seat at the table and finding another way to make this happen? So I think it's all about those learning experiences that we have along the way.
That was fantastic, Leonie. I'm sure people really appreciated that, and they'll show you with their emoticons or emojis, because you gave really practical examples of, if someone asks me a question and I don't know the answer, what do? You gave a whole lot of ideas. Say I don't understand, go to someone in the break, ask someone at the end of the meeting, all those things, people thinking, how do I do that? And this is your lived experience, is fantastic. A CHF would love to be able to run communities of practice, all the wisdom that the community has already, where we could have a community of practice on being an advisor or being involved in funding and so on. We don't have funding to do that kind of work yet, she says, but we keep hammering away. I'd love to know from everyone online, would you like the idea of national communities of practice in all these different areas of research? Show me with your emojis. Would that be a good thing for us to continue to advocate for? And if you like it, make sure you mention wherever you are. We'd really love to see CHF funded to provide the structure for us to share our learnings and support each other. The more that people, particularly those people that have purse strings that they can open and close, know that we want this, the more chance we've got of getting it. I'm going to come to you now, Daryl, with a question about really great consumer partnerships, because you did talk a bit about that. Because we had a question about, how do you break through that barrier from tokenistic requests, I call it, consumer as the compliance tick, for a consumer to be on something or do something, to a really effective and valuable partnership. So for people who perhaps haven't had the success that the gay community had in really getting that going for HIV, what are the first things you might encourage people to do? Where can they start?
Oh, that's a great question. Look, there is tokenism that we see. I think there's a whole lot of really good work happening to get us beyond that place. If you're a researcher these days and you're not taking consumer and community involvement seriously, you're really putting yourself in jeopardy in terms of your ability to secure research funding, from entities such as the NHMRC and MRFF, because consumer and community involvement in research is really considered increasingly not a good to have, not a nice add-on, but actually an essential part of demonstrating good research practice. So we shouldn't be seeing tokenism. We sometimes do. What do you do as a consumer when you experience it? That's tricky because tokenism isn't something that we as consumers create. It's something that is a choice, a decision, a failing of the researchers that sometimes we're working with. And I don't think there are easy pathways through that. But my experience is that that when this works really, really well, it works because it's working for everyone, right? It's working for the consumers who are involved because they're just so excited to see the progress that's being made, to see these incredible researchers, working day in, day out on the questions that actually matter to us. So we're really invested as consumers in what they're doing. And on the other side, the researchers themselves are so grateful to have consumer interest, consumer engagement, consumer curiosity, to have people that are saying, oh my God, that study you did was just so interesting. And, it's so lonely doing research. Anyone who's done a PhD, gosh, that's got to be the most torturous kind of, most isolating experience. And so for someone to say, your obscure, arcane research topic was interesting, it's an amazing thing for researchers often to experience that. So I think the pathway to actually genuine relationships between researchers and community is both the researchers and the community and the consumers actually understanding this relationship makes research better. And that's why I think it's so important that we think about this in relational terms. We think about it in positive terms. It's got to work for everyone, but most of all, it's got to. We're the beneficiaries as consumers. We want good research, so we've got to be invested in building these partnerships, being positive, being proactive, being valuable in terms of the contributions we make to research.
Great, thanks. I'm going to throw this question to all of you, and I'll start with you, Melissa, which is a question about meaningful engagement. So what do you count as meaningful engagement with consumers in research? What does it look like?
It looks like being engaged as early as possible, not the night before an application's due to go into a funder. It's having a diverse group of consumers who can contribute their views and wisdom. And it is, as Daryl said, the relationship and making sure it's two-way, and know you'll get a very quick antenna whether your input is valued or not. And when it is, it's very exciting. I describe it as a lily pad with patients or consumers and researchers, and we hop from one lily pad to the next to get that incremental change or that cure. And I've seen 2 of those in my lifetime, and I'm very grateful that I've felt my time has been well invested.
And Leonie, what do you think meaningful research engagement for consumers looks like to you?
Well, I'm just going to add on to Melissa, because it's that early engagement, but it's the continued engagement. So very often, unfortunately, it's happened to me that, last minute you get asked to, can you quickly look at this for me? And you put a lot of time and effort into giving constructive and meaningful feedback back to that person, and then you never hear from them again.
Yeah.
And so it would be lovely to know that, thank you for your input, but I missed out on my grant this time, but or yes, I did get the grant and we'll be in touch. And that's true and meaningful engagement. Then once the grant supply received, is to continue that communication as like you're part of the team, not just an add-on all the time. So to me, I think that's, and I've had some really great relationships with many of the researchers I've been so fortunate to be engaged with. And it sort of goes back then to that prior question. It leaves it open for me then to be able to ask them questions as well. And it's that two-way relationship that makes all the difference. And I think we can learn from each other. And I just wanted to also say, while I had the chance to be speaking, that, back in the very early days when I started, it was HIV and AIDS that we really took a lot of learnings from and examples from in that breast cancer world, is how we did it. And I can very much remember looking back and reading about how it was done, and how people back then just really stood up for what they believed in. So I think, it's probably not quite answering this question, but I just wanted to say that, because there's opportunities to learn from each other in different, like I was in cancer, HIV is different. We can learn from each other in so many ways.
Yeah, absolutely we can. The last question I'm going to ask you, I'm going to go through to you, Daryl, in case you want to add to anything about what meaningful looks like to you, but I'll get you to think about this one. In the chat, we've had a few comments, people saying a lot of people have been around for a long time. How do we get new people involved? So I think my question is, like, how do we draw in more consumers, give them the confidence, and also give them a sense that they're going to make a difference, so they should invest their time because it'll be worthwhile? What do you think? How do we get more people involved?
I think it's who the we is in this context. So is it researchers that are needing to get more people involved, or is it us as a consumer movement that need to get more involved? And I think it's actually, truth be told, a bit of both. I think one of the things I reflected on my slides was there's literally millions of people participating in research in Australia in continuous ways. It's a massive, massive enterprise, this kind of world of consumer participation. Often that participation is as a subject, if you like, in a study, rather than as someone who's being actively engaged and involved in the governance of a project. But there's a massive amount of participation. I was talking to someone yesterday who made me feel incredibly old by reminding me that actually young people don't read emails. They actually work through other digital channels these days. That emails is considered pretty old-fashioned, which is a bit terrifying for someone who remembers a time before email. But anyway, so I think part of this is actually about engaging people with where they are and where they live. When we talk about young people or people who are new to research, I think we have to be really conscious that sometimes there's a lot of privilege that comes for those of us who are able to participate in research, whether that's just taking the time out of our days to be interested and curious, or to be a participant. If you've got kids, if you're working 2 jobs, if you're trying to hold down work and study, those sorts of options might not be available. So not everyone has the same sort of opportunity to participate. We need to be sensitive to that. And as advocates, also very conscious of our expectations that researchers make it possible for us to participate. That could be through consumer remuneration, etc. Just a very quick comment on the engagement question for me, which was such an interesting question. What does it mean for there to be meaningful engagement? And one of the aspects for me, which is very important, we've touched on it in a couple of different ways, is that as consumers, we don't need to imagine that we're researchers. We don't need to sort of be trying to be like researchers. We don't need to understand every measure of statistical difference. We don't need to understand all of the technical science that goes in. There's a point at which you can get lost depending on, how big that gap is. But actually, when we try and behave like researchers, or when we try and, move into that space, we're actually leaving our own space, which is as consumers, as advocates, as people with lived experience. So when we step out of that role, the researchers are no longer getting what they need and what's most valuable for them from us. So it's a word of encouragement for us to be mindful that, yes, even when we're trying to build those partnerships, we're trying to get beyond tokenism. The pathway to do that isn't by trying to be a researcher. The pathway to do that is to be authentic in our own experience and to be thinking about what our experience looks like across the diversity of people that have that experience. That again goes back to being connected to our own communities and our own community organisations that are so invested in these research outcomes.
Fantastic, thanks. I'm going to ask you the same question, Leonie and Melissa. We've just got a few minutes left, so if you've got any other ideas to add, in terms of how we get other people involved. So Melissa, thoughts, other ways to get people involved?
I would make sure you ask the project team that have they allocated some budget to recruiting and educating and supporting consumers. And on the flip side, are your researchers being supported to work positively with consumers? It's two-way, and you'll soon work out whether they're genuine or not. It's going to be inevitable soon. Every grant's going to have consumer input, and get ready for it because we all need to be involved.
Great. Leonie, any other ideas of how to get other people involved in this really important work?
I think it's about when we start, if the researchers start to engage the community as a whole, like talking about what they're doing and bringing the whole community in and having some events and sessions where they bring the community in, people will start to then get enthused and get excited about it. And, it's a really very exciting area. Not everyone likes it, but I've just really enjoyed the times that I've been able to be engaged with researchers. And, I think people need to understand that they're not going to be on their own, that there are people there to guide them through, to help them through. And I think, I talked about training in my talk, and I think mentoring is a really, really important part of that, so that people don't feel like they have to do it all at once, that they can learn and grow as they go. And I think people then will become confident and stay in this space, not just leave.
Great. Thanks very much for those thoughts. We've got one more poll. So before anyone else shuffles off, and a couple of other things to mention, we'll put that up now. The question is really to ask you about how did this webinar go for you? So after attending the webinar, how would you rate your confidence in understanding the role of consumers in research? I'll give you a moment to vote on how much this has been helpful in terms of your confidence. From fantastic to I don't really think I can comment. I don't know the answer to that question. Whatever you like would be really terrific. And just as people are voting and we're getting into that wrap-up stage, I would like to encourage you to think about coming to our next webinar next month, which is to understand the vaping reforms. These will have a huge impact on people, and they're changing again in just the 1st of October. So it's a really hot topic. We're going to have some great presenters, so I would encourage you to do that. So we're almost at the end of our time. I'd love you to give a big thank to our amazing presenters, Melissa, Daryl and Leonie, who have done a terrific job in providing all of this really great lived experience as consumers who research. I would love to also thank all of you for the amazing questions and the really dynamic chat. I hope you feel like you were engaged and we weren't talking to you so much as with you, though it's difficult when we're in a Teams environment to do that. I'd like to give a big thank you to our staff, to Liz and Shannon and Morgan and Ben and many others who were involved in preparing this and running today, because it takes a lot of effort at our end, but we hope we can do this as best as possible to really make you feel like we're listening to you and it's your webinar, not just ours. I'd like to thank you for joining us. We will send you out the link and all of the information that was provided today. And we hope to see you on our next webinar next month, and perhaps one time soon. Some of you will also be our speakers and panelists. That would be terrific. So thank you all for your attention and your involvement today, folks. And we'll leave the chat just on live for a minute or two till past, in case anyone's got any more comments they want to make before we close the webinar itself. So thanks, folks, and have a great rest of your week.